The breast cancer screening and awareness exercise aimed to enable persons with disabilities and the vulnerable to access information on breast cancer and receive treatment when needed. Over 100 women and girls with disabilities benefited from the program, which saw health professionals from the Adabraka Polyclinic educate the women on breast care and how to identify symptoms of breast cancer. Speaking to the media, the chief executive of the Serwaa Amihere Foundation and the director of the Voice of Women and Children with Disabilities in Ghana both called on the government to provide sign language interpreters across all healthcare facilities to avoid miscommunication and misdiagnosis.
We are urging the government through the Ministry of Health and the Ghana Health Service to ensure that there are sign language interpreters at the various health facilities to help these women whenever they go to the hospitals or the health facilities to access health care. Because imagine a woman with hearing impairment going to the hospital and then there's an education about breast cancer and the person is not hearing whatever is going on, or the person goes to the hospital to narrate to the doctor what her problem is, and then the person is giving wrong medication. And it's not just the deaf women, other women with other disabilities are also going through other challenges because of these gaps in our healthcare system and even in the economic system.
The government to equip the health services with the necessary equipment and sign language interpreters to be able to attend to the unique needs of the different impairment categories in the country. And we also urge all philanthropists and other helpers to come on board to support, improve the health care of women and girls with disabilities, and also make their services accessible and then affordable to all.
Additionally, some persons with albinism called on the government to implement measures to make sunscreens available and affordable to reduce skin cancer and deaths among them.
Sunscreens in Ghana are not that easy to find, so most companies who sell sunscreens sell them in dollars, and it ranges from $28 and above. So the smaller size can be $20, $30, $35, $40. Even it's more than that. It depends on the size.
We are urging the government to ensure that sun creams for persons with albinism are made cheaper and then accessible so that women and children with albinism can have access to it to prevent excessive cancer in their skin.
The Serwaa Amihere Foundation, as part of its economic empowerment program, will provide capital support to 10 women with disabilities to start or revamp existing businesses, enabling them to support their families and become more independent.
We as a foundation have taken it upon ourselves to support women as part of our livelihood empowerment project. We support women with funds to start businesses, to be able to support their families and become more independent. And so this year won't be an exception. What we are rather going to do is to include more women with disabilities. And we have selected some 7 to 10 women from here, and we are going to provide them with seed capital to start businesses or revamp their old businesses. There are graduates here, people who have gone to universities and they are here jobless. They have a lot of ideas in mind. We have selected some of these people and we are going to support them with funds to be able to start these businesses so that they can also employ other people. And then that's how development is done.
The breast cancer screening exercise by the Voice of Women and Children with Disabilities in Ghana and the Serwaa Amihere Foundation screened over 100 persons with disabilities.